Good day, and welcome to Detecting the Right Fit, Finding an Accredited Nurse Residency Program. I'm Dr. Sherry Cosme, the Director of the ANCC Practice Transition Accreditation Program, or PTAP for short, and the Advanced Practice Provider Fellowship Accreditation. I'm excited to bring this content to you so you know how to find the right nurse residency program as you embark on this amazing profession of nursing. As we dive into learning a little bit more about accreditation and what it means for a nurse residency program, it is important to know that not all nurse residency programs are accredited. Accreditation is a peer review process by which a program puts its nurse residency program against a set of standards. That accrediting body, such as the American Nurses Credentialing Center, then validates that program against the set of standards that the program has written to. It is important to know that accreditation of nurse residency programs is a newer concept and has been around since roughly the late 2000s, but over the last 10 years, accreditation of nurse residency programs has started to speed up. And as you'll see soon, we have a large number of programs accredited across the United States. As I alluded to on the previous slide, we have 250 accredited programs in 839 healthcare organizations. What that means is 250 programs have sought ANCC PTAP accreditation to validate its nurse residency. The second number, 839, is important to know because, as you know, in healthcare there are systems. And about half of our accredited programs happen in systems where there might be two or more healthcare organizations that are a part of that system, which means that some of those programs have many sites within their healthcare system that have earned this designation. When we look at a transition to practice program or a nurse residency program, it is important to know that accreditation standards are looking at the entire experience that you will go through as a newly graduated nurse. That is from day one of hire all the way into the completion of your nurse residency program. The goal of a transition to practice program or nurse residency program is to provide you with the knowledge, skills, and abilities to be a safe nurse at the bedside. Many times within a nurse residency program, you have a precepted experience, you have simulation, you have didactic activities, you have projects that you need to complete. And it's important to know that when you're looking for a nurse residency program, that you're looking for it to be a comprehensive, fully developed program and not just a precepted experience where you just have time with a one-on-one nurse. You need more than that. And that's been proven in the literature that you need more than just a precepted experience. You need time and support to be successful in your role as a newly licensed nurse. Any program that's gone through the ANCC PTAP process has to have written a self-study to our ANCC PTAP standards. Those standards are all encompassed within our ANCC PTAP framework. This framework provides guardrails for a program to live within. The first domain, program leadership, talks about how the program director of the nurse residency program leads the program and is accountable for all components within the nurse residency experience. Program goals and outcome measures is what we like to consider the North Star of that nurse residency. How is the program proving its worth? How is it proving that it has a North Star in what it's trying to achieve? Organizational enculturation, the third domain, is how nurses are brought into the organization and become a part of the nursing culture. How are you assimilated and integrated into the profession of nursing within your healthcare organization as well as the greater profession as a whole? The fourth domain, development and design, is basic educational design principles. Who's the faculty? Who are your preceptors? How are they educated? How are they evaluated? What are your competencies? What does that curriculum look like within the program? How is your program put together in basic words? The last domain, practice-based learning, is what I like to consider the boots on the ground experience that you as the newly graduated nurse will experience. How are you learning key concepts that are essential to your success as a new graduate nurse within your practice setting? How are you given time and support to be successful in attaining those competencies? And how are you ultimately progressing along Benner's theory from novice to expert? How are you and the program being held to a higher level of standards through ANCC PTAP? The ANCC PTAP and APFA team have put together a tool to help you detect that right fit in a nurse residency program. This resource provides you with information on what to look for in a nurse residency program, as well as interview tips and questions to use during the interview process. We hope that this guide is something that you can use as you embark on the amazing profession of nursing. On behalf of the ANCC PTAP and APFA team, I wish you much luck and success as you embark on one of the most amazing professions in the world, nursing. I hope that with this resource that we provided to you, you are able to find the right fit in your first nursing job, and hopefully you'll be able to grow within the profession of nursing. Congratulations and good luck, and have fun finding that right fit.